very fast. The speaker for today's function. So on behalf of the entire Dabur team here and of course from the Delhi Corporate Office, we invite and welcome Dr. Samarth Rao.
Thank you.
Please. Thank you, sir, for dedicating your valuable time, at least a couple of hours with us. Thank you so much.
వక్రతుండ మహాకాయ
సూర్యకోటి సమప్రభ నిర్విఘ్నం కురు మే దేవ సర్వకార్యేషు సర్వదా. Hari Om Dhanvantri to all of you. Firstly, I am very humbled. Thank you Dabur India for organizing this seminar, and I am very humbled that I get an opportunity to sing the praise of a lot of our medicines, the Swarna Kalpas, as requested by you in this session. I also welcome all the Vaidyas who have come to be a part of this seminar, and let us cherish and experience all the different knowledge that the Shastras have given us. What to do is copy and paste. The whole pasting procedure is what makes a good Vaidya. Generally when students, we have a lot of students as well, welcome to all the students too. In the college you will get to learn, you will get a degree, you will learn a lot of knowledge. But to come out as a practitioner, as an enterprising practitioner, we have a lot of practitioners here among us, very successful practitioners, and that the quality is being enterprising. When new doctors come to our hospital, they feel their duty is only to do a round right and everything. I say no, you have to learn to do a massage, you should learn to powder the herbs, you should learn to give it to the patient. So to be a good chef, you got to learn to chop, clean the vegetables and serve it. That will make you a good chef. So first invocations to Lord Ganapati. You can see why I choose this picture is because it symbolizes gold, because we're going to talk about gold today. And Mahaganapati, you can see with all this luster, so you can see the bright light. That's why all our Rashastra books start off with Mahaganapati sloka, so that in fact my previous presentation when I presented Agnivesha, I had presented a picture of Lord Shiva giving Shiva Gutika to Lord Ganesha, with Parvati in the background. So this is Lord Ganesha. This is Bhagavan Dhanvantri. Dhanvantri is Swayam Mahavishnu himself. He is like the CEO. When things don't go in order, he gets into the act. He comes into the institution, he speaks to the security fellow. So Mahavishnu, when there was a lot of diseases going around, there was a fight between the gods and demons, so he incarnated as Lord Dhanvantri. This Dhanvantri picture is the Dhanvantri picture as depicted in Tantra Sara Sangraha textbook of Srimad Madhvacharya Sri Ananda Tirtha Bhagavad-pada. There he says how Bhagavan Dhanvantri, he has a Chandra Mandala at the background. When you are doing prayer to Lord Dhanvantri as well, this picture is what we'll have to meditate on. So that cooling moonlight is coming from him into us and into our patient. In fact, Ananda Tirtha Bhagavad-pada also says that while treating a patient, you should imagine when you are giving a medicine, that moonlight from Dhanvantri flows into you and into the patient. That will do a lot of healing. This is my father, late Dr. V.R. Padmanabh Rao. He is, of course, my guru as well. And of course, his close Shishya, Dr. Raghavendra sir, is here. So whenever he is here, I get a presence. My father is also there. So because he is a very close proximity to my father practiced very classical medicine, and he was an expert in infertility treatment. And I have seen a lot of Ayurveda as a child from him. This is my mother, Dr. Shubhankari P. Rao. She's also an exceptional Ayurveda practitioner. Day in and day, night, I always see her energy levels, her inquisitiveness to treat patients. Till today, she comes home, refers textbooks to see how best you can give. This is my mother here. I feel very fortunate. I will also mention my wife, Dr. Vibhuti Rao as well, because we practice together, and and she plays a very important role. We treat a lot of fertility, and in fertility, right, males don't easily come for treatment. The couple comes. I always start off this thing with a case scenario where a couple came and showed to Dr. Vibhuti for 2 years. The wife, he was bringing the wife, Ultimately, he came to me upon a referral of Dr. Vibhuti Rao, and this patient, then when I sent him to a test, he was azoospermia. He did not have sperms in him. So it's a very sad situation. So my better half is very important in my practice because she's the one who refers a lot of male patients for me. So this presentation, I will start off with this sloka in Rasa Chandamshu. Mrutam hatakram divya kanti tanoti kshata shwasa kasa kshaya pitta vato prameha grahini atisarascha kushtam jvaram hanti va shandhyam kandarpadam cha shandhyam. So here you can see Swarna Bhasma is extensively used in fertility. Now there is a lot of news this thing as well, that they have found gold nanoparticles in sperms, in semen sample. So you can see it's a life-giving force. You can see the sperm, you can see the head of the sperm. It has a lot of chromosomal material in it, the nucleus. That is where the DNA carrying ability that is passed on from the father to the mother, where mother is the kshetra, father is the bija, and then this transforms. So in this whole process you can see the role of the sperm and the shandhata. In shandhata how Swarna Bhasma is used. I will not make it a very infertility seminar. I'll quickly show 4 of my yesterday's success cases. I'm just talking about yesterday's success cases. Today morning I thought to include these 4 slides. I went saw yesterday's case sheets. In that I picked out 4 cases. I'll show you this. Probably yesterday I've seen 15-20 male fertility cases, but I'll just show you these cases before and after, and how Ayurveda has helped, and then later on I will go to all the others. This is a azoospermia case. Bilateral small testis. The testicles are really small in size. They're not normal in size. He had come to me in November 2024. Absolutely zero count. A businessman, he and his wife, a very young couple, very shy. They want to tell the world about it, and they used to come after I close the clinic because they don't want to show their face to everybody out there. So azoospermia, small size testicles. The whole challenge is to keep the patient hooked up, and you can see October 2025 his count has shot up to 12 million. Okay, then in February this month it is shot up to 28 million count. This couple were surprised. They used to come with doubt, sit in front of me, don't know where, they don't have any other place to go. It's very hard to be childless. That's the end statement. This is one case that's come yesterday. One more case yesterday was an oligospermia case, where bilateral small testis, same situation. May 2025 his total sperm count was 8 million. Few years, no children yet. January he took all my treatment, prescribed treatment which I give, panchakarma, I give a lot of medicines. And it's not just about giving the medicine, it is about convincing the patient to continue. Gold rates are going high over the roof. Okay, January 2026 his count has shot up to 445, so 445 million sperms.
How many months?
This is almost taken 7-8 months, 6 to 7 months. This is another Tiratuzuspermia case where morphology now, every other male who is coming into my clinic I am seeing they all have low morphology sperms. If you have sons, if you have male offsprings, please make sure you feed them well, put them into good habits. It's going to be a very dangerous situation if we don't change the society. Every other male has morphology issues. His normal morphology was 1%, and then in January when it was repeated again, it is shot up to 8%. A lot of IVF doctors see these results and they refer patients to me as well. So these are some of the cases that I've showed. What is the power and capacity of Ayurveda? Like Dr. Raghavendra sir always says, we are blind. We hold the leg of one elephant and we think that is the elephant. Okay, but Ayurveda is very vast. Ayurveda is very fast, and to know Ayurveda, we have to really work towards making Ayurveda, because the amount of results this Shastra gives is spectacular. Now, Swarna Bhasma, Rasatarangani says, Mrutam Suvarnam Madhuram cha Vrishyam Rudheyam cha Netram Paramam cha Medhyam. See, in Sanskrit when they use adjectives, you got to really, my God, this is really very important. See, he says Madhuram cha Vrishyam, Hrudyam, it's good for the heart, it's good, Vajikara, Netryam, good for the eyes, Paramam cha Medhyam, one of the best for the brain. One of the best for the brain. The brain activation is the most important. That's the reason Swarna Prasha is given so much importance. Why Swarna Prasha? Why is to feed kids Swarna Bhasma? Is because it improves blood circulation in the brain. Rasayanam pumsa nopayogi vishapaham kantikaram cha shastam. So this is very good in reducing even all the various vishas in the body. All kinds of Garavisha, Jangalavisha, any kind of poisons that have entered into your body. As well in Rasa Chandamsha he gives, where all medicines fail, use Swarna Bhasma. I will give you an example in a case where I used, in most of the cancer cases where, of recent I'm getting a lot of cancer referrals, a few are getting good results. So in most of these cases they come last minute. They've lost all that weight, they're not able to breathe, the only option is an ICU, they come, they say Ayurveda, you give something. That time you can use Swarna Bhasma preparations. That will prolong their life. There was a pancreatic cancer case who got referred, a bachelor, 70+-year-old gentleman who flew in all the way, he took a one-way ticket from Canada and decided I'm going to die in India. He was given a few weeks to live. This guy took a one-way ticket. He came to Shubhankari Ayurveda Chikitsalaya. He made that room his home. I got scared. Where is this guy going to, he does not have brother, sister, if it happens, what not. He gave me confidence. No, doctor, don't worry. So, he stayed in our center for, I think, 4 or 5 months. 5 months he stayed. But ultimately then we had to move him to another higher care. His pancreatic cancer is a very aggressive form of cancer. It grew and blocked the biliary ducts, and jaundice was uncontrollable. So there was a lot of things. But this gentleman, once I used to always go in the afternoon to meet him, and we were sitting in our dining area and he was very sick. But still he mustered all his strength and came and sat in front of me. We were talking to him and immediately he collapsed. I checked his blood pressure, which had gone down to, I think, systolic diastolic was 70/50 and 60. It was really going down. So we don't know, in a situation like this, it's quite bad. One Bruhatvata Chintamani Rasa. In front of all the junior doctors, I gave one Bruhatva Chintamani sublingually under his tongue. His BP shot up and he started conversing. Bruhatva Chintamani was one of the drugs that I constantly gave him, because Vruddhopiva Tarunaspardhi, even an old man will become young. So in a patient who is approaching mrityu, death, if you want to sustain him, you can use drugs like Bruhatva Chintamani and things like that. You can push him to the boundaries.
Just 300 rupees per tablet.
ಇದು ಜಾಸ್ತಿ ಆಗಿದೆ ಇವಾಗ. ನಾವು ಐ ಥಿಂಕ್ ವಾಟ್ಸ್ ದ ರೇಟ್ ಡಾಕ್ಟರ್? 300 ಫಾರ್ ನೌ. ಗುಡ್. ಸೊ and also for helping children. Now we can see it's the best Ayusthapana. It gives longevity. Smriti Prada, good for improving memory. See, when he tells Tridosha Jvara Nashana, it means all diseases. Jvara is used as a term where it's not only fevers, but technically all diseases. Saundarya Mukhalavanyam, women also like wearing gold ornaments and beautification. They look very attractive in that. Vagvi Shuddhi Karam Param. I will give you an example of a child later down the cases I'm going to present. Chinta Shoka Bhaya Krodha Bhutamaya Nashanam. In modern day lifestyle, these MLAs, MPs, amount of stress there in. Yesterday my accountant was there, saying, doctor, he had come to my practice, he was sitting in my consultation room and he was telling, doctor, yen madadu ella notice galu, I'm getting lot of stress. So I told him, sir, you will need Swarna Bhasma. You need to consume gold. Because what it does Chinta, Shoka, Bhaya, Krodha, Bhutamaya Nashanam. You take it. It is very, very useful. Even if you start taking a pinch of Swarna Bhasmam. It improves blood circulation in the Shiras, brain. How does it act on the... When Sushruta Samhita, in the pediatric side, he says the Swarna Prasha preparation. I follow that. What I do, I take one portion of Swarna Bhasma, Kushtha, Brahmi, Shankapushpi, Vacha. I powder it together and give it to the patient. 100 mg Swarna Bhasma. I think you have 100 mg packs, right?
We don't have 100. Yeah, 125 mg.
125 mg. So you can take 100, 125 mg pack. You can mix it with a little bit of Vacha, Shankapushpi, Brahmi, Kushta, and tell the patient, parents itself to do complete mixing of it. Around 125 mg. If you can give it for 3 months. See, that you can keep one spoon. Okay, mix it together and they can give it every day. As per Shruta Samhita, it says Vidanga Matasho Masi Pravardanti. The size of a Vidanga fruit quantity, and monthly it has to be increased from second, third, fourth month onwards. So that 125 mg Swarna Bhasma can be divided to 3 months for an infant. That is 1 to 2 mg per day. And then as they grow older, you can make that 3 months, 2 months. You can make that 1 month. So that way you can give Swarna Prasha in your own clinic very well. And you can recommend it even to patients. You don't have to bring the baby every Swarna Prasha once a month. I don't encourage once a month. I tell them give every day. No, why only give once a month?
Just one point there, sir. That's the reason we have come up with the tablet 2 mg standardized dosage.
Okay.
Compassion tablet for this convenience.
Wonderful.
Can customize and use it.
Very good.
Dispersible form.
Very good. So another thing is, it stops Asti Shotha. Now, we all know Bhratva Chintamani, Dr. Raghavendra sir also, the amount of backache cases he has dealt with Bhratva Chintamani. At the level of the bone, even in gouty arthritis, Bhratva Chintamani reduces that inflammation in the bones. So it is mentioned, it stops bone swelling, depletion, and also joint pains. When you give Bhratva Chintamani or any Swarna preparation as such, it will help you in that. It cures Firangi Roga and Mushka Mamsha Vriddhi, excellent in Unmadana Pasmara. I will give you example of certain cases. Chittodvega Brahma Glani Nashayet. You see all the word, when he is using Nashayet, it destroys. So it's better than any other. Parama Ojo Vardhaka. For heart palpitation is good. Kasa Shwasa, Atisara Grahini Pandu, Pavanam Pravriddham. It also normalizes the aggravated Vata. In certain cases, there is a lot of vomiting and diarrhea together happening. Patient is very tired. You can give one Swarna Yukta, Sudshekara, Swarna Yukta medicine, which will immediately help in arresting that situation. Shishunam cha paramam prashastham. It is best known for children. So gold means for children. Now, see, there are some Amayuka Prayogas. First these three slides, I'll just show you some Amayuka Prayogas. Have a look at it. Hope it triggers some curiosity for you. You can see how the appropriate Anupana is given. Rasa Sindura is used. Rasa Parpatis are used. Example, Grahini Roga, we all use Parpati Kalpas. So in that, you can use Raja Ikshma, Garbhashaya Shuddhi. You can see all the different Amayika Prayogas. For Swarabheda, you can see Yashti Madhu being used. Some more you can see all the Amayika Prayogas of Swarna Bhasma. There are some in Rasatarangini, Adrushya Deha. There are some formulations, very interestingly it is given. Falashrutis, you please have a look. With all Nagakesara, drug toxicity, you can see all these different Amayika Prayogas. So, I'll come to some cases. There was a child who came to me, brought by his grandmother. Family of vegetable sellers, wholesalers, city market. This boy did not speak. You would think whether this guy is actually deaf and dumb. You cannot hear, can't talk technically. But he responds to calling his name, clapping, showing him, he responds, goes, does everything. He's very playful, but no words coming out of his mouth. Only blabber. So this guy came to me and started off with medications for him. I will show you the medicines that I have given. This is, and I try to look up review. See, in my practice, I have learned now to keep a lot of evidence. Because now in this age of Instagram, you have all these young budding doctors, highlighting. That's so nice to see, Ayurveda is being taken to the next level. But in this case, here they have put a review. It was very hard for me to look up foreign reviews. So this child was given Swarna Bhasma and Kumar Kalyana Vrasa, had added in proportion with Saraswata Churna. There are 2-3 varieties of Saraswata Churna. In one Saraswata Churna, Bhava Prakasha, he also says if properly given to cows, they will start reciting Gita. See, they might be poetic, but also which basically says it is very good as a Medhya, Smritikaraka. So this child, in 6 months, the last was he came and sang a song in my practice. This is that was the review. That was when the Google reviews. I did this case was in 2000 when I initially started practice, 2016 or 17, and this child was a very good success case. Anupana is also very important. Brahmi Gruta can be given, Kalyanaka Gruta can be given, Saraswata Gruta can be given. Ghees are very important, and also some kind of encouragement to the child as well from the parent side. We had a very determined grandmother here, where the parents were very young, I think. We had this grandmother who would come afford that gold medicine back then. I used to give it off with the MRP and but now the gold prices are reaching the roof. Coming back to fertility, I ran 4 cases of male fertility. Who is this? Thanks to AI, this is Makaradhvaja. Who is Makaradhvaja? Son of Lord Hanuman, Pavanaputra Hanuman. When Hanuman was Makara. So Pavanaputra Hanuman. Hanuman ka putra Makaradhvaj. So when Hanuman finished his activity in Lanka, he was tired, he went into the ocean and took a dip. There one of his sweat was swallowed by a fish and Makaradhvaja was born. He was so strong, he was kept as the caretaker of Patala Loka. When Hanuman went down to get Rama, I think Lakshmana, when he went down to Patala Loka to bring Lakshmana up, That time he had to fight this gentleman and got to know it is his son. He is so strong. Of course, Makaradhwaja got defeated, but this is Makaradhwaja. You can see he is half fish and half Hanuman. So Makaradhwaja is a exceptional preparation in Ayurveda, Vajikara, Rasana Adhyaya. There are 4 to 6 varieties of Makaradhwaja based on, it's sometimes even called Purna Chandrodaya. Purna Chandrodaya Makaradhwaja, Makaradhwaja Vati, Makaradhwaja Gutika, Makaradhwaja with gold, with pearl. There's a lot of, I think Dabur has Makaradhwaja Vati. Makaradhwaja Vati. In Makaradhwaja, key ingredient is Swarna Bhasma, Parada, Gandhaka. You can see the ratio. 1:8:16 as per Rasatarangini. As Baishaja Ratnavali, 1:8:24. You get the Gandhaka around. More of the Gandhaka, it can work very well. So this Makaradhwaja, I don't know what, being born in an Ayurvedic family, this is one drug that I dispense so much. I don't know, probably my previous life attachment to Makaradhwaja in some way. But I dispense anywhere between 100 to 500 tablets every day. Okay? This is a very important preparation which can be judicially used in all diseases. You can see the head of the sperm. So I told you Swarna Bhasma, where it helps in the brain area, circulation. In the sperm, it also helps in improving the head. See, this also, the sperm resembles a human being. You have the head, you have the body, you have the legs. So this itself goes, conceives with the egg, and then you have the embryo and the fetus forming. Okay? Baishaja Ratnavali Vajikara Adhyaya, it gives 2 valla, that's around roughly 300-400 mg dosage, which can be consumed. You can mix it with other drugs. He says, very interestingly, of course, it's Agni Bala Pumsamam Vali Palita Nashana. When he says Vali Palita Nashana, it's good for technically any dhatus in the body. Because up till the area of the hair, there is improvement. So it can be used for everything. It's a very good rasayana. Medha Ayu Kanti Kama Deepana Krutva. It increases the sexual desire in a person, both male and female. Makaradhwaja can also be given in females. That can help in enhancing their sexual desire as well. Abhyasad Sadhaka. Abhyasa Sadhaka is somebody who consumes Makaradhwaja regularly. By doing this, Puna Sevana. Before intercourse, during intercourse, after intercourse, it can be taken. See, once the semen is ejaculated, the body starts replenishing itself. Why in Ayurveda he says after the intercourse he has to have a glass of milk? They don't say have a glass of milk before the intercourse. But glass of milk and good food is advised after the act of intercourse, because that is when the body replenishment starts.
Before
Then,
also explain.
Payam
Shigra Shukrakaram. Before also explain.
Before also very good. Also after also. But after it is very, very important. Ratikale Ratante. Puna Puna. Mana Hani of woman Sunischitaha. That means he says you are able to retain an erection for an extended duration of time. There are lot of patients who come with this problem, and it's a very integral part of a male, because there's a male ego is also attached to it. When he's not able to perform, he gets completely turned off in his day-to-day activities as well. So they start looking for solutions to this with everywhere. Where the solution is there in Ayurveda. Consuming for 1 year, all kinds of visha, dushi vishas can go away from the body. Just as by reciting Mrityunjaya mantra, Trayambakam Yajamahe Sugandhim Pushtivardhanam, by reciting this continuously, you will get to conquer Mrityu. By consuming Makaradvaja, you can conquer Mrityu. So Makaradvaja can be given. I know a lot of doctors also in developmental milestones, they use Makaradvaja very well. That will help in development of the body and mind as well. Conquers Jara and Marana. Next I will talk about another gold preparation, Panchabana Rasa. Panchabana, Kamadeva, when I initially thought about why, then Kamadeva has a bow and arrow with 5 different kinds of flowers. This is formulated by Lord Parameshwara himself, increases Rati Shakti. Ingredients you can see Nagabhasma, Vangabhasma, Shankabhasma, Kapardika Bhasma, Suvarna Bhasma, and you have Dattura, Lavanga, Jatifala, all these ingredients are there. This Panchabana Rasa is mentioned in Yogaratnakara. In my practice, I've seen this is the greatest medicine for wealthy, because it's also wealthy. Panchabana, which used to be 2,000-3,000, now it's 6,000, 7,000. Now we have to come up with convincing the patient. Now the whole dynamics of how to give gold is, you should find out where it can be used and how you need to convince the patient to purchase gold medicines, to encourage them. Sometimes I get patients coming with a prescription. Doctor, this doctor I went, he gave me medicine for 10,000, 15,000. So I tell them, see, he's given a very good prescription. You need gold there. So use gold where the problem is really high. In cases like cancers, in case of children, where parents both are working, they can afford it. Encourage gold. Tell them the benefits of gold. If that child consumes Swarna Prasha correctly for a month or 2 months, properly with correct dosage, the Shastra says once the child hears, he can remember once. Eka Shrutidhari, he can hear once. Okay? So just by hearing once, he can remember it. Agna Siddham Idam Rasayanam Panchabana, while I am giving Panchabana to my patient, I'll tell the medicine, go, do the job. It will do it. These are lohas. These has parada in it. It has a life force in it. It can listen to your command, is what that says. Agna Siddham Idam Rasayanam. Full instruction of the Vaidya. Balam Vayam Sthapanam. Vidvamsana of Prameha, Pliharoga, Jalodara, Ashmari and Apasmara. So I don't think so anybody uses Panchabana here. I am encouraging you to use Panchabana. So this case is a recent case that I treated. He's been taking since a while. And this gentleman was put on an anti-epileptic drug of 1 gram. And a good engineer, he had seizures, so so the specialist doctor put him on this. Now the parents are worried, how can I get my son married? You won't tell he's on epileptic medications. So the challenge was, they came to me with, we want to get him out of this drug. Initially he reduced it from 1 gram to 500 mg and had a seizure, had an accident. In seizure patients is very hard. You know, if they're driving, and I had a patient's brother of mine who is an excellent driver. He's rammed it into a truck. Fortunately, he has rammed in up to the chest injury has happened. So because they lose consciousnus completely. So in apasmara and seizures, it is a very dangerous situation. So in this case, with Ayurvedic medicines, second attempt where I used gold medicines, I'll show you which one. And we reduced it from 1 gram to 500 mg to 250 mg, and now it's 3 months with no medication. He has not had any seizures. This is all the good effect of Brahmivati Swarna Yukta and Chaturmukha Rasa. I will tell you details about what Chaturmukha Rasa is. But in this patient, he did Vamana Virechana and Nasya procedures for 15 days. He took Snehapana, we used Kalyanaka, Brahmi Gruta. This is all textual stuff. Bhaje, Vacha is one of the best in Apasmara. Brahmi, Jatamamsi, Smriti Sagara was given. Tantu Pashana, I will remember Dr. Bapat sir of Sagar this thing, but Bapat sir who started Tantu Pashana, unfortunately recently he passed away, but his exceptional work in this amazing results with Apasmara. But the important thing was Brahmi Vati Swarna Yukta and Chaturmukha Rasa. They are gold preparation because they are best in Unmada and Apasmara. Second case is of a lady, husband is a businessman, has a huge retail outlet. He has brought machines from Germany, and a nuclear family, father, mother and daughter. Daughter and father busy in business, mother has psychiatric issues. If she starts creating scene in the house, shop is also closed because everybody has to be around. She sits and cries. She does not want to come out of her room. She says, none of you give company to me. She keeps complaining. She's on a list of psychiatric medications. She can't sleep. So this patient came to me when I was practicing in Bank Colony, and through a referral, and they came and told, you don't do all treatments for me. I don't do oil massage, don't do basti, don't do nasya, don't do nothing. So what I will give you? I gave, initially I gave Kalyanaka Grita, Brahmi, Saraswata, all they brought it back. Doctor, she is not taking this. I devised a simple method. I gave Chaturmukha Rasa. Chaturmukha Rasa was given roughly 125 mg dose with Triphala Churna with honey every day. And they kept coming for 3 or 4 months. Where?
mg total.
No. Andre Chaturmukha Rasadalli ಬೇರೆ ಇಂಗ್ರೀಡಿಯೆಂಟ್ಸು ಇದೆ. ಅದ್ರಲ್ಲಿ 125 mg ಡೋಸೇಜಲ್ಲಿ 1 ಗ್ರಾಮ್ ಇಂದು ಸ್ಯಾಚೆಟ್ ಬರುತ್ತೆ. ಆ ಸ್ಯಾಚೆಟ್ನ ಡಿವೈಡ್ ಮಾಡಿ ತ್ರಿಫಲ ಚೂರ್ಣದ ಜೊತೆ ಮಿಕ್ಸ್ ಮಾಡಿ ಅದು ಒಂದು 15 ದಿವಸಕ್ಕೆ ಕೊಡ್ತಾ ಇದ್ದಿದ್ದು. They have 3 to 4 months and exceptional result. She started feeling good, but also I altered her diet where I told her to have chapatis, green gram, red rice, ghee, some fruits. These are the list of the fruits that I had given her. This is a general list that I use. I was in Australia for 10 years, and in Australia, while I was having my weekend practice there, we had to stick to only diet and everything. So I have made diet charts for every disease, from Vaishesha Ratnavali and everything. So this I have printed out, and every patient that comes, I give them, nimge piles idya, piles idu patya kodi. So all these are small strategies that you make your patient's life comfortable. So this is Chaturmukha Rasa. As you name say, it was revealed by Lord Brahma to Vaidya Krishnatreya. Vaishesha Ratnavali Vata Vyadhi Chikitsa. You can see the combination there, Shuddha Parda, Shuddha Gandhaka, Swarna Bhasma, Abraka Bhasma and Loha Bhasma. In any of the preparations, the dose of Swarna Bhasma is always restricted to 15 mg to 30 mg. But depending on the condition, it can be increased or decreased based on your discretion. Chaturmukha Rasa. Look at the Falashruti of it. Vali Palita Nashanam, Agni Balam, 11 types of Kshaya. Somebody who is losing weight, you can give Chaturmukha Rasa. Pandu, Prameha, Shwasa, Shula, Mandagni, Hikka, Amlapitta, Vrana, Adhyavata, Visarpa, Vidradi, Apasmara, Maha Unmada. So these two conditions, where in the 2 cases I showed you example of a epilepsy patient and a Unmada patient. Both conditions you can use. Like Vajra of Inda and Felling, it is used a very nice example there. Strinam Prasava Karanam, Balyam Pushti Ayushyam. And Chaturmukha, last he says Chaturmukha recited with all his 4 mouths. The technically telling was...
1 second. So 4 ಕಡೆ ಕೆಲಸ ಮಾಡ್ತೀವಿ.
Next is a very common condition that you see is pediatric cases. This case I will remember because son of an industrialist and father, mother very educated. They run a huge industry, and this son, they showed his report card, immunization report card.
Actually, I took a photograph of it. I spent some time in the morning in my old phone, I could not find it. Filled with immunizations. So many immunizations. When that child came into this thing, was so weak, not looking at his age, very light, and every other, when I started treating them, for every other small things they would call. He went out gardening, he got sneezing. There was dust, he started getting cough. So you can see trigger factor so high. In a typical case like this, it is not the body that is causing the problem, it is the modern medicines that are given to him. The body becomes dependent on them. All those inhalers, the antibiotic, why the body has its own ability to fight bacteria and viruses. Why do you resort to antibiotics? Antibiotics works, but you are depriving the body to develop its own immunity and a system to deal with these things. So this child was bombarded with every other immunization, every other antibiotic, inhaler, and all these different things. The last was an ICU. ICU brought him to Ayurveda. They come to Ayurveda last resort. Correct. So everything, okay, you have to do anything, do. I tell boss, come first, no, come initially. Initially they go to the modern doctor. Cancer is happening quite a bit now. They go there, finish everything, then they come last resort. Oh, I heard from somebody else, you are the savior. So what can I do? Fourth stage, everything gone, platelets coming down, is deprived, losing weight, there is ascites. What Ayurveda can we do? In sense, in a case like that also we can start working. But come early, more better. So in this case, this guy, immunization and his history was huge. So I started off on Ayurvedic medicines for him, and the medicine I used here was Kumara Kalyana Rasa, Vasanta Malati Rasa also. Kumara Kalyana Rasa is, my late father would give a lot of Kumara Kalyana Rasa. I would see many children, they have grown up now and they come to me for follow-up and they say, your father had given me medicines, he has given me gold medicine, and now my cough went away in 6 months. I had that, this, that. Kumara Kalyana Rasa. Generally, these are some of the combination. In this case, I particularly gave him Agastya Rasayana. It's not a very tasty preparation. Usually, Chavanaprasha can be given. Dashmularishta, Vasarishta, Karpuradarka, Kanakasava. Rasa Pipari Rasa is another excellent preparation in pediatric cases. Gorochanadi Matrulu, Siddha, Gorochanadi Matru also, that is, they use the bile of the thing, very good in reducing fevers. In pediatric cases where the temperature comes up and everything, it can be reduced. Kasturadin Shvasakutara Rasa. This boy recovered very well, and occasionally he comes for his cough and cold and takes Ayurvedic medicines from me. He is fine now, he is not gone to the ICU anymore. You can see. That's one company. Incops. Kumara Kalyana Rasa. Baisaj Ratnavadi Bala Roga Chikitsa. You can see how a Bala, Pralad, 5-year-old boy in the lap of Lord Narasimha. So I thought this is the best picture to depict it. You can see Rasa Sindura, Swarna Bhasma, Mukta Bhasma, Swarna Makshika Bhasma, Loha Bhasma and Abarka Bhasma in this preparation. Kumara Kalyana Rasa, half to 1 mudga, like a green gram. That size you can give with milk. Instead of giving hundreds of churnas for that child to lick, the parent running behind the child, Amma, take it, Appa, take it, Athu, all this drama gone. You give that 1/2 Kumara Kalyanama, enough. It's simple. We should start thinking like this, because what we have made Ayurveda is, it's become a huge trial box for us. It's very important that we come out with bullet treatments, minimum medicine, maximum result. That is important, with least harm. That is another thing, because we have to make sure we should not do harm to the patient. That is the first thing, because that they will blow up and they will tell, oh, they took your medicine, he went to the toilet 3 times. Okay. So you see indications. Kumaranam Jvara, Shvasa, Vamana, Parigarbhikam, Graha Doshas, all that child weeping, crying, urinating, tantrums, unable to speak, everything, all these balagraha doshas, stannasya grahanam, kamala, atisara, even in childhood jaundice, it can be given. Then also increases. Nashayet natra samshaya, again last he has told, without doubt, it will nashayat natra samshayaha. This is Vasanta Malati Ras. I think Dr. ಇವ್ರು ತುಂಬ ಉಪಯೋಗಿಸ್ತಿದಾರಲ್ವಾ, ಯಾರು ಡಾಕ್ಟರ್ ತೀರ್ಕೊಂಡ್ಬಿಟ್ರಲ್ವಾ, Raghuram Shanai used to give lot of Vasanta Malati Ras. During COVID time, Vasanta Malati, for all his patients, he had told to take it on a regular basis as a immune booster.
It's called Sarvaroge Vasanta.
Sarvaroge Vasanta. It's so great it is. See, Jeerna Jvara, Vishama Jvara, Kasa Agni, and most of the fevers that you get now are all because people have taken paracetamols. All Vishama Jvaras only. All that Kshaya Roga, in Stri Roga it can be used. This is one area where women can start using Yakrit Pliha Vriddhi, Nishakti due to old age. So, is very good. Vasanta Malati, you can see Moktika Basma as well. Yashada Basma is there. See, Yashada Basma, zinc. So, another preparation I wanted to add here was Vasanta Kusumakara Rasa. You can see Kanta Loha Basma and all these various others. Basmas can be used very well in conditions of Prameha. In Prameha, where the challenging is you're trying to get the patient off modern medicines, reviving the pancreas, rebooting the system to be receptacle, you can use Vasanta Kusumakar Ras. You got to use more, got to be bold, got to, the patient has to afford it, Adhya Rogi, very important. Dose it can be given one morning, one evening. Vali Palita Rudyam Smriti Brahmsha Vinashayet Kamada Sukadha Statha Mehagna, degeneration of Dhatus, Pushtidaha, Kanti Vardaka, Balya Ayushya, Putra Prasava Karana, to gain progeny. It can be used in also fertility. Prameha, all 20 kinds of Prameha, Kshaya 11 types, Soma Ruja also, especially in women. It can also be used in cases where they have their uterus taken out and they have all these body pains and everything that come because of that. Also Vasanta Kusumakara can be given. So this was a whiplash case that this lady came to me through a referral, and she was in a car accident and there was a whiplash. Whiplash is when your head goes and comes back. So she had chronic pain, and one problem that she developed was tinnitus, that noise, and she had gone berserk. All her family, Karnanada, all her family members were looking for solutions. She was part of all Facebook groups, morning, night, reading stories about Karnanada and tinnitus. It was a tinnitus world. When she came for consultation, I sat her down. She was all over telling me everything about tinnitus. This is very disturbing, unable to sleep. She had lost weight and everything. So in this case, I treated it with a lot of medications. So some of them that I used was Panchamrita Lohaguglu, Yogaraja, Mahayogaraja, Vishtundikavati, then Mahamashthaila, Shiro Abhyanga, Griva Abhyanga, and also Karpa Sasyadi Taila Nasya. What worked in this case was Rasaraja Rasa. It was a wonderful preparation. Though the expensive medication, but Rasaraja Rasa, if you are able to sell it very well, cervical problems, all kinds of Vata Vyadhis, it is very, very powerful. Especially even you get patients who come and say dizziness, I have tinnitus, Rasaraja is the king. You give Rasaraja and it will completely go away. You can see Rasaraja Rasa, Vaishesha Ratnavali, Vata Vyadhi Chikitsa, Rasindura, Shuddha Parada, Swarna Basma, Abraka Basma, then you have Vanga Basma and Loha Basma in it. Anupana, Kshira and Sharkara, Paksha Ghata, Ardita Vata, Hanustamba, Apatantraka, Dhanustamba, Apatane, Badirya, Mastaka Brahma, Sarva Vata Vikareshu, Rasaraja Prakirtitaha. See how he describes Prakirtitaha. During those days in all Vata Vyadhis, they used to give Rasaraja Rasa. Balya, Vrishya, Bhogya and Vajikarana Uttama is Rasaraja Rasa. In all Pakshagata cases, in stroke cases, I think Ardita, we can give this front line. This is one area. I don't treat so many stroke cases. Occasionally I get with Bell's palsy and I do the regular thing, Mukhabhyanga, Gandusha, Nasya and things like that. But Rasaraja Rasa is another drug that we can work in this area. My experience with cervical problems, I give Rasaraja Rasa. This case I have recently shown it even at my other Agnivesha presentation. Old gentleman who came to me unable to pee, and he is already on prostrate medications from a long time, and doctor told, Appa inna nimge yadu aushthi agala sir, dayavittu surgery banni, and he does not want to go to the hospital. So sometimes Ayurveda we get left out cases. I tell, when that time comes in Ayurveda, they come to Ayurveda first. We can literally make these drug companies out of business. I mean modern drug companies.
Many people, they don't know about Ayurveda. These are lastly they will come to know about Ayurveda.
See, one thing in Ayurveda drug companies also, the contribution is immense. It's very important. We as an industry go together. We need the drugs. At the same time, we need Vaidyas. My father would tell, Ayurveda paristhiti hengide andre iga, the situation of Ayurveda now is, there is a big restaurant. One side they are making wonderful food. Dosa, all rice bath, nice appetizers, everything. And the other side there are people standing. Are hungry, we want, take money, we'll eat. Our waiters don't have hands. That is the situation of Ayurveda now.
So they are all the waiters.
We are the waiters. We have to serve it to the patients. See, the problem that is happening now is, Ayurveda is shifting. It has to be practitioner focused. Practitioners are the one who give. See, just knowing the Shastra is not enough. They read it, tell it. Read it, that is the way they wash it and dry it, repeat it. But when you do it, when you give it to a patient, when you see the result and get back, and that way you wash and dry it, you will get a lot of experience. That way Ayurveda can reach to the mass. So what is the point me doing 100 classes on a drug? And when, the more experience you get by treating 1,000 cases with that drug. That is very important. It's very important that practitioners should be the focus. Now, I can tell, now Dr. Rakesh also is an excellent practitioner. If he comes out and shares his experience with treating certain drugs, certain diseases with a drug, is more beneficial than anything else. So it is very important that practitioners be placed out there to train young doctors out there. They don't have role models. Because the people they see out are people who practice there in the institution level. It's like a swimming pool. Everything is regulated there. When you come into the ocean, Dr. Sunil sir, now the amount of problems Dr. Sunil sir is doing is exceptional. Getting KPME registration. This recently, he was there in Yelahanka police station on behalf of an Ayurvedic doctor. We were all aware of it in the group. One big applause for the doctor. The amount of good things he is doing. So this is all the things that are happening in the private space. Once you finish graduation, when you come into the open, how you survive as a practitioner, how to treat a practice, how to make a living out of Ayurveda. When I take some of my colleagues to the hospital that we have constructed, I proudly tell, every brick I have paid out of the money I have earned through Ayurveda. I have not earned through any other way. Nobody has given me donation. No government has come and given me funding for it. Look at big institutions, they are all funded. Now, Dr. Raghavendra sir also is constructing a wonderful resort somewhere in Chikbalapur area, Dotpalapur area, wonderful. The amount of strain is going through. How he is, everything is out of Ayurveda. He does not have any other side income. I know he does not know anything else other than Ayurveda. He is extremely multi-talented. But this is the thing. And how to be a practitioner? You have to mix with practitioners, like coming to Agnivesha Ayurveda Anusthana. where is a wonderful association, lot of private practitioners there. So they know, there we discuss, and there we can role play and learn. So in this case, this gentleman, so he came to me, his son brought him, sir, ನಮ್ಮ ಅಪ್ಪಂಗೆ ಸರ್ಜರಿ ಬೇಡವಂತ ನೀವೇನು ಮಾಡ್ತೀರಾ ಮಾಡಿ. So they knew I am the only resort now. So I used gold. So that is where you hit the target. You can't use gold for somebody else who comes for cough, quickly cough. ಏನು ಮಾರಾಯ ಬರೀ ಕೆಮ್ಮಿಗೆ 4,000 ರೂಪಾಯಿ ಇಷ್ಟೇ, ಬರೀ ಕೆಮ್ಮು ₹1,200 ಇಲ್ಲೂ ಹೋಗೋಣ ನೆಕ್ಸ್ಟ್ ಅಂತ. ಸೊ ಆಂಟಿಬಯೋಟಿಕ್ಸ್ they'll compare costing also. In this case, when he came initially, his prostate was 115 grams, was huge. He was not able to pee. I started on Ayurvedic medicines. He started peeing. Further down the track, it came down to 97 grams. Further down, in between there is one more. Further down the track, it came to 74.7 grams. There is one more which says it has come down to 41 grams.
Super.
Prostate enlargement come down. While I was making this slide, I called this guy's son. ಅಪ್ಪ ಹೆಂಗಿದ್ದಾರೆ? ದೆನ್ ಸರ್ ನೀವು ಕೊಟ್ಟಿದ್ದೆ ಲಾಸ್ಟು ಅದೆಷ್ಟು ಇಳಿತಲ್ವ ಅಷ್ಟೇ, ಇವಾಗ ಹಂಗೆ ಸರ್ಜರಿನೂ ಮಾಡಿಸ್ಕೊಂಡಿಲ್ಲ ಸರ್. This is 2 or 3 years now. So I called him, he spoke to his father, so sir ನೀವು ಕೊಟ್ಟಿದ್ದೆ ಲಾಸ್ಟ್, ನಾನು ಸರ್ಜರಿಗೆ ಹೋಗಿಲ್ಲ, ಇದೆಲ್ಲ ಮ್ಯಾನೇಜ್ ಮಾಡ್ತಾನೆ. ಸೊ he is on that one prostate medication, but Ayurveda helped him to reduce. So prostate, there is excellent treatment for this. I used Bruhat Purna Chandra Rasa, ಶತಾವರಿ ಘೃತ, ವತ್ಸಮಾಂತಕ ಘೃತ, ಗೋಕ್ಷರ ಚೂರ್ಣ, ಚಂದ್ರಪ್ರಭಾವಟಿ, ಚಂದ್ರಕಲಾ ರಸ, ಗೋಕ್ಷರಾದಿ ಗುಗ್ಗಳು, ಶಿಲಾಜಿತುವಟಿ, ವರುಣಾದಿ ಕಷಾಯ, ವೀರತರಾದಿ ಕಷಾಯ, ಲಾಟ್ ಆಫ್ ಮೆಡಿಸಿನ್ಸ್, ಬಟ್ ಹಿ ಟುಕ್ ಇಟ್ ಬಿಕಾಸ್ ಯು ಹ್ಯಾವ್ ಟು ಗೋಸ್ ಲೈಕ್ ಎ ಲಂಚ್ ಬಾಕ್ಸ್. ಬೃಹತ್ ಪೂರ್ಣ ಚಂದ್ರ ರಸ ಸರ್ವವ್ಯಾಧಿ ವಿನಾಶಾಯ ಕಾಶಿರಾಜೇನ ಭಾಷಿತಃ. ಕಾಶಿ King of Kashi prepared this Bruhat Purna Chandra. Purna Chandra Raso Namna Sarva Rogeshu Yojayet, formulated by Kashi Maharaja. The Dhanvantri also comes in the family of the Divodasa Dhanvantri. So Kashi Maharaja propagated it. You can see all the ingredients as Rajata Bhasma also, Swarna Bhasma, Tamra Bhasma, Kansa Bhasma, Jati Phala. So all these things are there. ಸರ್ವವ್ಯಾಧಿ ವಿನಾಶಾಯ ಸರ್ವರೋಗೇಶು ಜಾಯತೆ ಬಲ್ಯ ರಸಾಯನ ವೃಷ್ಯ ವಾಜೀಕರಣ ಉತ್ತಮ, ಸ್ಪೆಷಲಿ ಫಾರ್ ಅಸ್ಥೀಲಿಕಾ ಹಂತಿ. ವಿ ಹ್ಯಾವ್ ಟು ರೀಡ್ ಫಲಶ್ರುತಿ ಆಫ್ ಫಾರ್ಮುಲೇಷನ್ ಫಸ್ಟ್. ವಾಟ್ ಫಾರ್ಮುಲೇಷನ್ ಇಸ್ ಅವೈಲಬಲ್ ಇನ್ ದ ಮಾರ್ಕೆಟ್? ವಾಟ್ ಈಸ್ ದ ಪಾಯಿಂಟ್ ರೀಡಿಂಗ್ ಅಟ್ ಅ ಫಾರ್ಮುಲೇಷನ್ ನಾಟ್ ಅವೈಲಬಲ್, ನೋಬಡಿ ಮೇಕಿಂಗ್? ಓಕೆ, ಸಿ ಆಸ್ ಎ ವೈದ್ಯ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಸ್ಕಿಲ್ ಇಸ್ ಯು ಶುಡ್ ಬಿ ರೆಡಿ ವಿತ್ ದ ಅಸ್ತ್ರ. When the patient comes, you will not have 5 minutes. You have to give the medicine, give it to him and send him away. If you don't have any of that, what is the point knowing it? So being prepared, being enterprising, being prepared is the first skill for a Vaidya. You should have that set. If I dream, after college, what I should have done, maybe I would have made a kit for fever this, for jwara this, for atisara this, for even I'm talking to companies to encouraging them. Help students make a kit so that they can use it immediately. Otherwise, shelf life 6 months gone, you will forget everything. Then Ayurveda, no, what should I give? You will contact your friend who is working in Kottakkal, who is working somewhere. So that will be the situation. You should always be practicing Ayurveda. So you should have those medicines. If you have 2 lakh rupees, buy medicines and keep it with you first. First keep it with you. I have Naradiya Lakshmi Vilas Rasa. I have Gandhaka Rasayana. Skin problem comes, I can give Gandhaka Rasayana. I can give Arogya Vardhini Vati. Being prepared. So if you have Bruhat Purna Chandra, it's important. Don't just give prescription and reduce Ayurveda to level of retail. I am also, next thing is fight for no prescription. Like allopathic drugs, our medicine should not be available on Amazon. It has to go through us. Why are we educated? It's very important as doctors, we hold the right to prescribe and give. Without our prescriptions, it should not be honored at all. It's been sold on Amazon, it's sold everywhere. So this is one thing that I'm really working on. So it's very important that we are the gatekeepers of Ayurvedic medicines. Balya Rasayana Vajikana, Astilya Kasa Shwasa Rochaka, Amashula, Katishula, Richshula, Paktishula, Agni Madhya, Ajirna, Grahana, Amavata, Amlapitta, Bhagandara, Kamala, Pandu, Prameha, Vata Shonita, Vata Bahuvidham, Mandagni, Vamana, Nata, Paratara, Shrestha, Vidayate, Vaji Karmani. So this is of course very good in Vajikara also, because it's Bruhat Purna Chandra. This was another case. Also I told one of this thing, his PSA was 29.05, reduced to 1.9. This is a ischemic heart disease. This also I presented at Agnivesha. I tried to put in new cases. I have to spend more time. I was given 5 days, 1 week time. But next I will have to look up all my case sheets. This case was a young boy whose wife had just delivered a baby, and his BP was very high when he came. He came for a massage because his back was paining. I checked his blood pressure and everything, and it was high over the roof. Then I sent him to a cardiologist to get an evaluation done. His ejection fraction was 45%, mild LV systolic dysfunction. And this guy was told to undergo surgery, okay? But he wanted Ayurveda, he had a baby. I put him on complete diet, and you can see how his ejection fraction shot up to 60%. But he took treatment for 4 months. I also gave him Arjuna Kvata Matra Basti. Also the Rudaya Basti was given. But most importantly, Swarnamakshika preparations were given, like Prabhakaravati, Rudaya Navarasa, Bruhat Vata Chintamani was used in this patient. So he afforded that medication. So these are all this thing. Ejection fraction shot up to 60%. One disease if you hold continuously, you treat, you can be a master in that. This is Bruhat Vata Chintamani. Dr. Raghavendra sir can speak length about it. I had the privilege, and I travelled with him once. He sat me down for 1 hour and gave me Upadesha on Bruhat Vata Chintamani. His experience. It was just marvelous. In that discussion that we had, there were nice points about Bruhat Vata Chintamani. Amazing medication. Swarna Bhasma 3 parts, Rajata Bhasma 2 parts, Abraka Bhasma 2 parts, Loha Bhasma 5 parts, Pravala Bhasma, Mukta Bhasma, Rasindura. This has everything in it. You can give it in Sarvaroga. You can become Bruhat Vata Chintamani doctor.
HOD of Vatarogas.
HOD of Vatarogas. Amazing. Yatha Vyadhyanupanena Nashayed Droga Sankulam. Roga Sankula can be completely dismantled. Now you get a case where there is water connection in the stomach, lungs, heart, the blood counts are coming down, weakness, constipation, cough, cold, everything together, Roga Sankulam, like a Yakshma, Raja Yakshma, Kshaya, it can be used very well. Vata Rogam Pitta Kritam Nihanti Natra Chintanam. Look at it. Don't even Vata Pitta Kaila, it can be used very well. Both these diseases it can be used. Vruddho Piva Tarunaspardi. Even an old person can become young, like in the pancreatic cancer case, how I have given Bruhat Vata Chintamani. Sustained him till 6 months, 4 to 5 months. Okay, every day he was given. Drushta Siddha Phalaschayam Vata Chintamani Svivam. So this Bruhat Vata Chintamani, exceptional preparation. So I take this one case because this is a very extreme case. I have also told it in Agnivesha. Army officer, he came to me with his brother-in-law and wife. I think he got referred by my classmate who was a major in the army. This guy is an electrician. From the ladder he has fallen back, okay, North Indian, and his advised surgery, his job is also on the line, everything. This guy came to me, I gave him pakka treatment, I told him, he came and got it done. He paid money, got it done. 30 bastis. Karma basti. 30 sittings. Kala is 15 and Karma is 30. His back pain vanished. And after that he came to me, he referred me patients, no back pain, nothing. Unable to stand, sit, do everything, vanished. I asked him, boss, please write a review. One line in English, in Hindi is written, मेरा कमर का दर्द ठीक हो गया. I was like, at least while he's writing his review, we can pump up, put his situation, मेरा कमर का दर्द ठीक हो गया. So I'll never forget this case. See, nowadays all these reviews are very important. Patients do full research and they come to us. I had given Gandharva Astadi Kashaya, Maharasnadi Kashaya, Prasarini Kashaya, Ashwagandha Rasayana, Ashwagandha Leha, Trayodashanga Gugulu. That Trayodashanga Gugulu and Falashruti is Gugunu Kalpas only require very deep. Yograj Gugulu, Mahayograj Gugulu, Vata Gajankusha is very equivalent to anything. Of late, last few years, I have been using Vata Gajankusha extensively. It is a number one drug. Vata Gajankusha. Brihat Vata Chintamani Rasa, Vishatundikavati, Ashwagandha, Kapikachu, Murivenna, Mahamasha Taila, Katibasti, Kashaya, Matrabasti. I had given 30 sittings, he took it. Recovered. So, these are the various cases I have dealt with. These are some of this thing I have done. And gold medicines very judiciously. Cost is very important. How much quantity? I spoke to very experienced Vaidya, Dr. Acharya sir, and he told me, Appa, ಒಂದು ಬೃಹತ್ವಾದ ಚಿಂತಾಮಣಿ 2 ದಿವಸಕ್ಕಾಗತ್ತೆ. You don't have to give it one morning, one evening. If you give, very good. But one Bhuratvata Chintamani, 2 days once is enough. If you give 7 for 15 days is good. 15 for 30 days is also good. Unaffordable patient. Don't sleeve him off the money.
Swarna Prashna iddange.
Swarna Prashna iddange. If he is affordable, give him 2. One morning, one evening. Dosage wise it's okay. But Bhuratvata can be given that way. How you convince the patient is also very important. Convincing end. It depends on your skill and everything. Sarvato Bhadravatti is another wonderful preparation you can use in kidney related problems, where even dialysis patients can be reversed. I have not got that opportunity to treat that many cases. My opportunity is more with male fertility. Every day I get a lot of male fertility cases. Male fertility is one area I am sitting and working. Dhanvantri sends me a lot of patients with male fertility. From opportunity also in Ayush TV, somebody came and gave me an opportunity and they made me a sex doctor overnight. I thought, it's okay. So I've given a biggest episode on sexual health through Ayurveda. Vajikara, I did justice to that. So, Vajikara also is very important, very part of life. And there are wonderful gold preparations that are useful in that. So, judiciously, well planned, you can use gold medication. And also there are certain, I was speaking to a doctor, she's a Amrita, Dr. Amrita. She's a gold medalist in Rashastra. She makes Swarnabhasma by herself also. So we were discussing about how gold can be used, gold can be prepared. You please pick up that challenge and show it to the Ayurveda fraternity.
But actually, gold preparing Swarnabhasma is very easy, but the price is too much.
None costing adhe nodde. He said, so you take Swarnabhasma, then mix it with Rajata, with Parada, it all works out costing. But he says you do this gold only for eradicating poverty and using it as for medicine.
Loha Siddhi ಮಾಡಬೇಕು ನಾವು.
Loha Siddhi.
ಗೋಲ್ಡ್ ಮಾಡಿದ್ರೆ ಮಾಡಿ ಐರನ್ ಇಂದ ರಸ ಸಿದ್ಧಿ ಮಾಡಬೇಡಿ ಹೇಳ್ತೀನಿ.
ಸ್ವಲ್ಪ ಕಷ್ಟ ಅಲ್ಲ.
Very nice.
Recently, my other this thing was in a cancer lesion using gold, because I used non-gold for cancers, but recently one case I have been giving Brihatva Chintamani as a thing, and it has helped eradicate 2 lesions in her. She came to me with one left breast removed. She had 2 lesions in the right. That has disappeared with Ayurvedic medication. No chemo, no radiation, nothing. And the 2 developing lesions in her right breast have reduced. Of course, I've given her other medication. One was Brihatva Chintamani also, because gold as nanoparticles has been trialed for cancer now. This is the area where we need to work. We need to sell it to the patient. We need to give the medicine, encourage follow-up, and document the results and present it. That is the only way that Ayurveda can advance. So thank you very much, Dr. Mubarak sir. I'm really surprised you're doing Langanam today, but